This is a test. How to take an impression. The items needed for mixing alginate is water, measuring cup, mixing bowl, your spatula, and your alginate powder. This is for taking impressions. We also want to make sure that we have all of our PPEs on. And the first thing that we need to do is fluff the powder. So make sure the lid is secure and gently fluff the powder back and forth. And then slowly open the lid. Then you want to take your measuring cup and measure out. And what we're going to do here is take our measurement. And in this case, we're doing mandibular, so we'll only need 2 scoops of powder. So you want to fill it up and tap down as much as you can so that all of the extra air spaces are out, and then scrape off any excess and put it into the bowl. And you want to do this twice. And after this, we should be ready to go. We also want to secure the lid on the alginate box so that way no excess moisture gets into it. The next thing that we want to do is make sure that our patient has the correct size tray in their mouth, and you can retract the cheek and make sure that the tray fits. And once that is ready, we are ready to mix our alginate. For maxillary, you want a 3:3 powder to water ratio. And for mandibular, you want a 2:2 water to powder ratio. And when we are mixing, you pour the water into the bowl and mix very quickly. And so it starts to set up, but we don't want it to set up for too long because then it starts to harden. We're mixing here. For mandibular, you want to place the alginate around the tray evenly. And then for maxillary, we want to put more of the alginate towards the anterior portion of the tray. That way, when we push the impression on the teeth, all the excess doesn't go down the patient's throat. Now she's smoothing it out nice and evenly. When we put it into the patient's mouth, we want to put some on the occlusal area and retract the cheek. And for mandibular, we push on the posterior first, and then we push on the maxillary. We also want to do border molding. This shows us any excess gum tissue. You want to let it set for a while. Make sure your arm is securely under the patient's chin. You also want to talk to the patient so that they're comfortable, and especially if they're gagging. To remove it, you want to just push up, and there'll be like a suction light, and pull straight out. Give your patient a napkin, but we first want to quickly disinfect with Biorex or any other disinfectant you have, and rinse off with water. Then you want to use a gentle stream of air to get any excess water out. You can also bag your impressions to last overnight with a damp paper towel and a biohazard bag if you need to. The next thing we're going to show you is how to pour up your impression. The items needed is a spatula, a flat surface, your impression, lapstone vibrator, your powder measurement, your water measurement, and your mixing bowl. There are different measurements that you need for powder, but in this instance, we're going to use plaster, so we will need 100 grams of powder to 45 to 50 milliliters of water. We need 100 grams of dental plaster that you will weigh out, and then we will add in our water. You also want to make sure you trim any excess off of your impression. When we pour the powder in, it needs to be going very slow, and then we are going to let it sit for about 30 seconds to get all the extra powder in. Once you start mixing, you should mix until it gets to a creamy cement-like consistency. We also want to make sure that we get all the powder mixed in there with the water. The next thing we'll do is use the Labstone vibrator to get any air bubbles that we need that are in the cement out, because when we pour up, we don't want air bubbles in our teeth, as shown here. The next thing you want to do is take the impression, put it on the vibrator, and take small amounts and put it to in the posterior portion of the impression. This allows it to spread throughout the entire anterior to the posterior of the other side. And this also gets out any air bubbles that there are. Once you have enough, you want to add just a teeny tiny bit more to the top and put it off to the side. Then what we are going to do is get any excess material that you have in your bowl and put it on your flat surface. This is what we are going to use for the base of our model. Make sure we get all the excess out of the bowl. Once we have all the excess, we're going to place the impression, the filled up impression, on our extra material, and we are going to smooth it around. You don't want it to be pancake-like. You want to make sure that it has enough around the entire part of the impression that we have. That way it's easier to trim up for us. The most important part is for the posterior of the cast that the plaster is put up into any little holes that you see. In this instance, we didn't have enough plaster, so we just made do what we did with what we had. You want to let it set for 45 minutes, and then we are going to take the cast off with a knife. You want to gently pull up all the way around the entire cast, get any excess material you need off. You want to twist it very slowly, and you might hear some popping, but that's okay, don't freak out. Very slowly. And then when we pull the cast off, we want to actually pull up very gently, just to make sure we don't break any excess teeth or anything that we will need for our impression. And this is about what it should look like when you take off your cast. When trimming, we want to turn on our water, and this allows it so that way the grinding portion of it doesn't get wore down easily and doesn't get too hot. It's also easier to trim your model. You want to line up the front teeth so that way you get a flat back. There are different cuts we need to do when we do maxillary mandibular. The maxillary has a pointed tip, and mandibular has a more rounded top, as shown here. They're both very similar, just the anterior portion is the only difference between them. Once we are done trimming our model, there are two things you can use to get any excess off of the front. You can use a Dremel power tool, as shown here. You want to hold it like you're holding a pen, and this is an acrylic lab burr he is using to get any ridges off. You can also use a knife just to scrape anything off that you don't like or you want to perfect it. He's getting off anything that he doesn't want or doesn't need there. All of these holes can be filled in with a slurry. You just mix up extra plaster and fill them in and then trim it again. And this is what maxillary and mandibular should look like. No model is perfect, but I think you get the hint of what it's all about. And this is about what it should look like without all the holes. But thank you so much for watching. I'll just do this where you're putting it on him. Yeah.
Stop pulling on it.
Are you ready? Give me a thumbs up. In the light. In the light.
Sucks.
Smile.
How's your day going? What are you doing today? You don't.